Welcome to Design Foundations, the podcast where faith, family health, and true wellness come together. I'm Kelly, an integrative health practitioner, optometrist, and mom who's been where you are. I know how overwhelming it can feel to navigate health challenges for yourself and your family. That's why I'm here, to help you uncover the root causes of those struggles and help you build an unshakable foundation for a thriving life where you feel rooted, replenished, and restored. In each episode, we'll cut through the noise, talk about practical tips, and share real-life stories to encourage and equip you. You've got what it takes to create lasting wellness. I'm just here to help you get there. Let's dive in. Welcome to Design Foundations, where we explore the connections between faith, health, and true wellness. Today, we're going to be diving into an eye-opening topic, one that is near and dear to my heart. It's a huge part of our story and honestly has the huge potential to change lives. And we're going to be talking about the link between gluten and mental health. We're going to discuss how gluten affects the brain, its connection to various diseases, and why a gluten-free diet may actually be a super powerful tool for certain chronic conditions. And this is a topic that is just not talked about enough. We're not educated on it. Parents are not educated on it. It's information that a parent needs, a teacher needs. Honestly, all schools and educators need, healthcare professionals need, and we just aren't doing it. We're just not talking about it. We're not educating on it. And this is information that, like we said, can absolutely change lives. So we're going to kind of do a deep dive into this. This has been a week, guys. I don't know. I tried to record this podcast 4 or 5 times and anything either time-wise or technical that could go wrong did. So I am super happy to be here and finally getting this information out here. If you follow me on social media, you see that I talk a lot about gluten. I've written articles on gluten, and I think many people think that I think everyone has a problem with gluten, and that's actually not true. It has been a large part of our story, and I know that there are many other people walking around just like my family. In fact, more than they even realize. So it's important for me. I feel really passionate about getting this information out there so that someone else that is listening, that's standing in the same shoes that I was in, or maybe experiencing symptoms that they're unable to quite put their finger on, or getting categorized into different areas, hopefully can take all of this information and be equipped to start walking with actionable steps on what to do next, whether it's for them or their own child. So I just wanted to talk a minute, just a little bit about why am I talking about this? How did this affect us? How did we figure it out? So I'm just going to start with a little piece of part of our story. With my youngest daughter was diagnosed 4 years old. She was showing all kinds of symptoms of lack of focus, constant irritability, mood swings, joint pain. Really, if we wanted to classify it, they would have said ADHD. I couldn't quite figure out what was wrong. I talked on a previous episode about some of the physical symptoms we also started experiencing actually later. But those things were like stomach aches, skin rashes, constant fatigue. What I now know is joint pain, but she would just explain that her legs were hurting. She was eventually diagnosed with celiac disease, and this is an autoimmune condition that is triggered when somebody ingests gluten. So we removed gluten from her diet like we were told. I completely expected things to improve. I was so excited that we seemed to get our finger on it and figure out what it was. But actually, for the next 3 weeks, something different happened. Her mental symptoms really seemed to worsen. She became very sad, angry, honestly, just really depressed and pretty unmanageable, if I'm honest. It was really hard. This was the opposite of what I was expecting. And no one had told me that there was an actual thing of gluten withdrawal. So gluten actually binds to the opioid receptors in the brain, creating an addictive effect. Okay, it's the same place that cocaine or something like that is going to bind in the brain. So when you move it, there's actually a short period of withdrawal that occurs and symptoms actually intensify. So once we were able to push through that phase, which for us was about a month, they usually say about 3 to 4 weeks, we were able to see that my daughter's mood improved, her focus completely sharpened. She was back to being herself again, we had been missing her for a very long time. I often say that her diagnosis was a blessing in disguise because of this. It really gave me my child back. And so it was a walk that really taught me how deeply food can not just affect the body, but is also affecting the mind. And what's interesting about this is even to this day, if my daughter gets glutened, I'm celiac myself. If I get glutened, I can actually tell long before I start to see even one smidgen of physical symptoms. I can see it in mental, brain fog, lack of focus, inability to process things quickly or appropriately, feeling very low or very anxious are all things that will kind of creep in prior to physical symptoms even showing up. So that's just kind of a piece into what caused me to kind of dive down this rabbit hole and really understanding this concept a little bit better. No one educated me that this was a possibility or even a thing. I really attributed gluten sensitivity and celiac just to the stomach, just to digestive disorders. And what I've come to find is actually it can present 100% neurologically. So you can have what we call silent gluten sensitivity, silent celiac, and someone may just present with the mental component, right? With the effects that it's having on the brain without having any of the digestive symptoms. Well, what do you think happens to those people? If you are experiencing anxiety, you're experiencing ADHD, depression, and you go to the doctor, what happens? Likely, you're going to end up on some type of medication that is working to treat the symptoms. But what if further down the line, more of the root is that the gluten is causing essentially leaky gut, which then crosses, we have these proteins that are crossing the blood-brain barrier, which are causing neuroinflammation, which are then creating these symptoms within the brain. Does anyone talk about maybe we should screen each of these patients and have them taken off of gluten for at least a minimum of 6 weeks to 3 months to see if there's any change in behaviors, any change in their symptoms before we start slapping these medications on people who may be on them for 5, 10, 15 years at a time. So it's really important to explore this, to have an understanding its effect and what it can do. Let's just back it way up and we'll talk just for a minute about what gluten is. And gluten's a protein and it's found in wheat, barley, rye, mostly malt. It's in a host of other things, but it's really what gives bread its elasticity, its chewiness. If you think of like a pizza crust or pizza dough rather, and you stretch it out, that's the texture that gluten is giving. So that's what gluten is. We see it in breads, pastas primarily. It's typically a huge staple in our Western diet. All right, so that's what gluten is. Most of us know that. The other piece of this is you might be listening and thinking, well, I don't have celiac disease, so this actually isn't going to be a problem for me, or this isn't something that I need to consider for myself or my child. But the reality is that is not true. So we have non-celiac gluten sensitivity, and there is celiac disease. So celiac disease is going to be an autoimmune condition. When somebody ingests gluten, there's going to be an autoimmune response. This affects the villi and the small intestine. They become blunted. We're unable to absorb nutrients. We often will get some type of GI type disorder. Many people assume that this is diarrhea. Actually, more often than not, it's actually constipation. It goes the other way. And then we can get skin rashes, headaches, a host of other symptoms. They can be physical. They can also be completely neurological, okay? That anxiety, the depression, the brain fog, lack of concentration, irritability, all of them fall into this category. Okay, so there's celiac disease, but there also can be non-celiac gluten sensitivity. So these are people who are going to have to experience the same symptoms without getting damage to the small intestine. So the symptom profile is actually the same, and this is affecting millions of people worldwide. Okay, so how does this happen or how does it work? And so you might be wondering, how does a protein found in grains end up affecting our mental health? And so the answer lies in the gut-brain axis. So this is like a complex communication network that links our GI system, our tract, to our brain. Okay, there's a nerve that runs all the way from the brain all the way down into the gut. So gluten can actually increase intestinal permeability. It causes inflammation. This is like big fancy word for leaky gut. Okay, that's what happened. This is. And this allows particles to escape into the bloodstream. So then these particles can cross the blood-brain barrier and potentially triggering inflammation in the brain. So we end up with neuroinflammation. And this inflammation is then contributing to the symptoms of the things that we've just talked about: brain fog, anxiety, mood swings, and the list goes on. So additionally, gluten-related disorders can also lead to malabsorption issues, which is going to result in a host of different deficiencies of essential nutrients like B vitamins, iron, vitamin D, whole list. And these are crucial for maintaining mental health. So a study was actually done that found that B vitamin supplementation significantly improved depression in adults with long-standing celiac disease who were on a gluten-free diet for this reason. So if you're wondering, well, how would I know if I have gluten sensitivity? What does that look like for people? It can be bloating, gas, diarrhea or constipation, abdominal pain, fatigue, headaches, migraines is a huge one that falls in here. On a mental health front, anxiety, irritability, brain fog, difficulty concentrating, mood swings or depression, and really that up and down. It's important to note that these symptoms often seem completely unrelated to gluten and or celiac disease, and this makes diagnosis really difficult. So I can't remember the exact number, but I think it's something like celiac disease has like 152 different symptoms. Well, what happens is it often gets labeled as other chronic conditions because the symptom profile is so wide, both for celiac and non-celiac gluten sensitivity. And so it presents when I come in with achy joints and arthritis, I'm going to get stuck with an arthritis diagnosis without ever exploring that possibly gluten is actually at the root of all of it. So simply stated, if you, a loved one, your kiddos are experiencing any of these types of symptoms, particularly in the mental health category, then it is certainly worth exploring gluten as a root cause symptom. May not be gluten, but why would we not rule that out? We've known since 1956 that when gluten is ingested, it can actually cause and be associated with mood and psychiatric symptoms. This is actually not new information. We're just not educating it on it well. So again, low mood, depressive symptoms, any type of bipolar, schizophrenia, irritability, anxiety, depression, any ADHD type symptom, inability to focus. These are all things that we should be screening for. These clients, these patients should all be screened for gluten sensitivity, not just celiac disease, but also gluten sensitivity. So you might be wondering, how do I go about that? What does that look like? You can certainly ask your doctor for a celiac panel. They will run that. This will not test for gluten sensitivity. It will only test for the antibodies they are mounting if someone's experiencing an autoimmune response. You can ask for a gliadin panel to be run. You can also, through functional medicine, run something like a wheat tumor that's going to give you much more information in regards to gluten sensitivity. How is your body responding to it? What parts of the gluten protein are you responding to? Is it affecting you neurologically? Are you going to tend more towards skin disorders or rashes or more towards digestive symptoms? So there's a host of information that can come from that test that I find very valuable. It's very, very important to realize that if you're going to do gluten testing, you cannot take gluten out of the diet prior to that. So this is a mistake that I see happen very often. So if you suspect that gluten is an issue, do not take it out of the diet prior to testing. It needs to be in your diet to have a positive result. If you're not going to go that route and you decide that you do just want to trial taking it out of your diet, then remember it needs to come out for 6 weeks to 3 months. This is not something that you're going to take out for a week or two and might see marked symptoms. And like we talked about, your symptoms may actually increase and go the other direction. So it's really important to keep it out for 6 weeks to 3 months to really have to make any kind of statement about whether it was a positive or negative for you and what your symptoms looked like. So there's testing. You can do, of course, an elimination diet. Keeping a food and symptom and mood journal can be really helpful, particularly with kids. Remember that responses to certain foods can happen up to 72 hours after you ingested them. So this isn't something like, okay, I ate a bagel at breakfast and there was no response by noon or even dinner time, so we're in the clear. These responses actually build with inflammation. And so the more that you consume, the larger those symptoms will be, but the more inflammation is building over time, and then your symptoms will mount. So when you're looking at your journal, you want to look at correlations from 3 days after, even when the food is ingested. That's why this can be a little bit more difficult, a little bit more time intensive, but it's definitely a more cost-effective way to do it if you are looking to go that route. Right now, the focus on medicine is really just kind of finding that single magic bullet, right? What's the quick fix that's going to treat this disease? It's going to make the symptoms go away. It's going to make my kid behave better. Maybe they'll make me feel better instantly. But chronic conditions are complex. They require personalized approach. For example, if someone with like colitis or rheumatoid arthritis or schizophrenia, they may all have similar symptoms. So like everyone that has colitis may present with certain digestive symptoms. Everyone that has rheumatoid arthritis is going to present with achy joints, etc. But their root causes and ideal treatments are going to vary widely. How they got to the point that they now have achy joints due to an autoimmune response to leaky gut may actually look different than the person that's standing next to them, also with rheumatoid arthritis. So it's very important to look at things from a very personalized approach. To truly heal, we have to shift back the focus from this one size fits all back to the individual. What's causing the inflammation in your body? For some, maybe it's gluten. For others, it could be environmental toxins, stress, other dietary factors, a little bit of all of the above. We have to recognize the complexity that is the key to moving forward. It's going to be effective for helping people move forward. So kind of just some practical, actionable steps. If you want to be tested, this is certainly something that you could ask someone for. Your doc, again, you can run a celiac panel. You can ask for a gliadin panel that's going to look a little more towards gluten sensitivity. Sometimes they're not as prone to run that. And I find that that's often because they don't run them very often and aren't sure how to interpret them when they come in. So be sure that you're working with someone that does have a good understanding of that. You can certainly also run something through a functional medicine practitioner who's able to give you some information there as well. You do not want to take gluten out of the diet if you choose to do that. You can definitely start a food and symptom journal, track what you and your family eat, or the person that you're kind of evaluating, see how everyone's feeling physically and emotionally is really important to keep in line there. Look for patterns like mood swings, fatigue after meals containing gluten. Again, those symptoms can arise for 72 hours, so keep an eye on that. If you want to do some type of elimination diet, you certainly can. So you can commit to removing gluten 4 to 6 weeks. At a minimum, I really prefer up to 3 months. Be prepared for a potential withdrawal phase. This does not happen to everyone, which is a really important point to make. Some people experience that neurologic component. Some people do not. There is a test, like I said, that will, in the functional medicine world, will dive a little bit deeper into that. But some people will, some people not. It just depends on the type of gluten sensitivity that they are experiencing. Outside of this, of course, supporting the gut is going to be really important. Removing gluten is just the first step, including gut healing foods like bone broth, fermented vegetables, restoring the gut lining, working with a practitioner, really because things are so individualized. One-to-one is going to be really helpful to improve overall health. And of course, be patient. This takes time. Remember that initial symptoms might actually worsen before they improve, but the long-term benefits are absolutely so worth it. I can't tell you how many children I come in contact with who have been just loaded up with medications. And if we had just dived a little bit deeper into the root causes, into their diet, been willing to take the time to support them, it's an adjustment for mom, family. I get it. It is a lot of work. I'm not going to sit here and pretend that it's not, but I'm absolutely going to tell you that it is so worth it. So if you have a loved one that you feel like falls in this category that might benefit from listening to this podcast, please share it with them. Please give us a like and follow if you are enjoying this, if you like this content. Before you close, I just want to remind you that moving forward in wellness is absolutely possible. It takes time, it takes patience, it takes faith in the ultimate healer. But every small step that you take for your family's health matters. Taking the step to go from, I think this might be affecting my child, to actually doing something about it is huge. That is the small actionable step. And we know that these are the small steps. When we're being consistent in those is when real transformation happens. So God has given us these bodies to steward. He walks with us through every challenge. Trust the process. Know that the effort that you're putting in absolutely will bear fruit. It is in good effort. You are building a healthy lifestyle and legacy to be able to give to your family and pass forward. So please know I'm always here for support. And if you feel like this affects you and you'd like some more information, please feel free to reach out. You can also see in the show notes, you can schedule a 15-minute free consult. If you're curious and want to dive in a little bit more on this topic, I'd be happy to chat with you. Thank you for tuning in to Design Foundations. I hope today's episode left you feeling encouraged and equipped to take meaningful steps towards building a healthier, more intentional life for you and your family. If you found value in this conversation, I'd love for you to share it with someone else who might need this encouragement today. Don't forget to subscribe so you never miss an episode. And if you're feeling inspired, leave a review. It helps this message reach more families like yours. Until next time, remember, true wellness starts with a strong foundation, rooted in faith, and grows with intentional care. Take care, and I'll see you next week.
This podcast is for educational purposes only and is not medical advice. The information shared is not a substitute for professional medical care. Always consult your healthcare provider before making any changes to your health or wellness routine.